Hi, folks. I'm Wound Care Karen. I love being a nurse, and I have a passion for wound care. I want to inspire nurses, educate patients, and have a little fun along the way. Today's episode is specifically for nurses, and I am so excited to introduce my guest. Her name is Maggie Ortiz, and she's a nurse advocate. Welcome, Maggie. Thank you so much for coming on.
Thank you for having me. I appreciate it.
Sure. Well, first, I would love for you to explain your nursing history. Like, how did you come to be a nurse advocate?
Sure. So I've been a nurse for 23 years now. I'm going on my 23rd year. So I started as an ADN nurse for 17 years in the hospital, critical care, ICU, ER, pre-op, PACU, endoscopy suite, interventional radiology, eventually on to the cath lab and electrophysiology, where I've spent like the last 10 years, 5 years I was there pretty much full time. When I had been practicing for about 17 years, had helped open up a freestanding emergency room, just got tired with, just that whole deal. And I saw that there was a position opened. I mean, I think like all nurses were always looking for that other job, right? So
Yes.
I saw something opened at the Board of Nursing as an investigator for the Texas Board of Nursing. I applied, interviewed, and then got the position. So then I just saw some things there that concerned me, and
Mhm.
I don't stand alone in this position. And I just have learned things along my journey as far as some of the lack of what I feel is due process that a nurses is extended. So that's what's led me to my nursing advocacy.
Wow. Wow. Yeah. And I have learned so much from you. I really, really have. Wow. So that must have been a bummer because, when you join a new job, you want to do so well and you want to have a great workplace and, oh, you just found things, weren't so great, huh?
No, just like I, scream and yell on other platforms, I had to leave. And
Yeah.
I tell nurses that it doesn't matter, even for me, the unit or the department that you're choosing to be in. If it's not a fit for you, then as nurses, we are amazing people and uniquely aligned to do whatever we want. If you want to
Mhm.
do, critical care today and full care tomorrow, you know what you can do? That
Yes.
we're amazing people. So I left. I left and I
Yeah.
went back to the cath lab. Imagine that, where I felt comfortable.
That's cool. That's neat. Yeah, no, I'm a firm believer in that too. If you have to believe in the mission and values of your employer or please leave. And like you said, there's plenty of other places for us nurses to land for sure.
Yep.
Yeah, and currently we're in the midst of a huge revolution in nursing. Nurses now more than ever they seem to be under attack. It's just rampant. And I've heard some people even call it a witch hunt. Sometimes I call it a witch hunt. Do you agree with that term?
I'm not, and again, I don't know that I had heard it before. Actually, I've heard people say that they're coming after us. Now, I
Mhm.
do believe to be some truth to that because you know why we're pushing back. What happens in any toxic or abusive relationship when you try to change the boundaries? We're here. And
Yes.
it's not like this is all brand new. There are people who've been asking and saying the same things now for decades. Decades. I literally was listening to a podcast by the RNA ladies, and I hate that I don't even know this gentleman's name who was on there, but he literally was quoting a nurse from 1943.
Yes,
And
I
I
heard
didn't
that
know
too.
when.
Yes, that was awesome. He
Oh,
read a quote and it talked about poor staffing, right? And staffing
all of
crisis.
it.
And he said, guess what year
Yes.
this was written?
Yeah. And
Yeah.
he doesn't lead with that because you don't know
No.
it. He doesn't lead with that. And you're like, yeah, absolutely.
Yeah.
Yes, yes. And then
No,
you're
he
like,
buries that
oh
lead.
my
That was
gosh.
an awesome punchline. Yeah.
Absolutely,
Yeah, so
absolutely.
right. So the nursing, well, the staffing crisis is not new. So, so clearly nurses have felt to be short-staffed for decades, clearly, So, but yeah,
But
it's
we're more
just
into business now, right? We're not really into healthcare, we're more into business. And if you're not willing to align with that position, then you know what? you're retaliated against. And whatever that looks like,
Mhm.
if you, and even the last place that I came from, and I'm not even going to go to those details, but if you stand up for against basically what is the business of healthcare,
Mhm.
5 years in, do you know it? No. 10 years in, you kind of start saying, I'm 23 years in. It's no illusion to me when you walk into any organization, unless it does not funded by CMS, Centers for
Mhm.
Medicare and Medicare. So who was that? No one. Unless you're straight up doing plastics or
Mhm.
dental, I mean, that's you. So you're in the business of healthcare, and the ones who've been in it for a while, it's just harder and harder to stomach. And we're being retaliated
Absolutely.
against. Yes.
Yes.
And called a witch hunt. Because
Right.
like anyone else who's spoken up, it's all the things. They just sometimes don't necessarily mess with me as much, or will make sure that they're dotting their I's and crossing their T's, because I'll sling out things like, oh, wait, hold on.
Mhm.
217 AST, that's in Texas, unsafe assignment. So S is, I believe, you making that assignment, and T is me accepting that. So, I mean, I could be wrong here. Did you still want me to do that? But don't kid yourself. You know, I still get retaliated against. That's why I'm not at the
Mhm.
bedside.
Mhm. Mhm. Right, right. So talking about our licenses and our profession and what it's become nowadays, can we go ahead and slip into then like the three different branches of law, so to speak, that kind of affect our professional licenses? If you can kind of describe civil and criminal and administrative and kind of break those down for us a little bit, because that's what worries me is because of this witch hunt or whatever you want to call it, our licenses are at stake, and that's our livelihood, literally, And like you, I've been a nurse a while. I've been a nurse. This will be my 29th year. And if I wasn't a nurse, like I don't
Yeah.
know what I would do. What would I do? I'm too old and fat to slide on the pole, It's like I don't know what else I would do. So talk about these different laws and
Sure.
regulations that affect our licenses.
Thank you for asking that, because that is something that I do lead when I do any kind of teaching or speaking or mentoring. The
Hmm.
first thing that we have to talk about is administrative law, because when you were handed your license, you were actually handed your administrative law license. And most nurses don't really understand what that means. And we are not taught enough about that in school. It's
I
like,
agree.
something that's like breezed over. And the administrative law are the rules and regulations, either for us in Texas, that is by the Board of Nursing. Not every state has what we know to be a Board of Nursing. It is under Health and Human Services. It's just the entity that is giving you the privilege to practice, and it's driven by law. You'll go to, I'm trying to think of a state that's not coming to me right off the top of my head, but you'll just go under Health and Human Services, and it'll be
Mhm.
the rules and regulations, and it'll say specifically scope of practice for
Right,
nurses.
right.
You'll find it for sure. So that is administrative law. So when does that cross over into civil? Civil is, I'm going to sue you. Civil is
Hmm.
when we think of traditionally, when we think of lawsuits and we think of money, we think of a
Fines,
physician
yes.
being, yes, sued
Hmm.
for medical malpractice, but that's also nurses.
Hmm.
So again, another stat that I like to pull in, and I have done civil expert work as well. That was my first crossover out of the board of nursing, was into medical malpractice as a civil expert in like the ICU, the ER settings that I had experience in. And
Hmm.
so that is different. That is going to be what a prudent nurse would or would not do in the same or similar circumstances. That is a different type of standard. And we are seeing that it's not just the physician that's being reported, it is the nurse. And so that is the second type of case. So the thing with that is, if you are, let's say, named or you're found negligent in a civil case, like it
Hmm.
goes all the way through and they actually find you negligent. Not that you were just like named somewhere in the body or you got deposed, but it didn't go anywhere. I'm
Hmm.
not talking about that. I'm actually talking about they actually found you as the nurse negligent of failure to whatever it is.
Hmm.
That when you go to renew your license, will have a question and I can't tell you, and there it is. I
Right.
saw your face and there it is. And I can't tell you the specific language because every state is different, but it does ask you, have you been, you know, found negligent in a civil case? And you know what you have to say? Yes.
Yes, right. Oh
Now
my gosh.
you're standing there as well. So then now, if for some reason it's criminal. So, and we're not talking about the nurses that are intentionally harming patients. So let's just get that out of the way.
Right.
Let's just say there's a medication error, there's something we've seen these in the media. Pennsylvania, Tennessee, right? We've seen nurses for different things, accepting an unsafe assignment, a
Mhm.
medication error, things that don't align with just culture, what we know just culture. Just culture, for nurses who don't know what that means, is the intersection between human error, which we know is reality. It doesn't
Mhm.
matter what profession you're in, human error is real. The Institute of Medicine talks about this. To err is human. The Institute for Safe Medical Practices talks about this. So it's literally the intersection of, unfortunately, human error and nursing or healthcare. Unfortunate things happen. So we have to put things in place to create safety. One of those things being the ability to safely report things so that system errors don't happen, or, processes change. But that could land you in a criminal case, or you get a DUI as a nurse. Even if it's adjudicated, and that's a word nurses don't know, but it's
Mm.
adjudicated, or I pled. That is guilt to the board of nursing, but I'm just on probation. No, those are probably one of the most common reasons why nurses reach out to me. Or a nurse reached out to me, a DUI that rose to felony.
Oh wow. Oh
So that
yeah.
got different. Either it was maybe and I don't know criminal law like that. Maybe it was the damages to the car or the patient, or I don't know. But for whatever reason, that DUI rose to felony.
I
Most
see.
states have language that say, as a nurse, if you have a felony, you're not a nurse.
Right.
They'll normally ask you for you to surrender your license, depending on the conduct. Like if it's just so gross, they're just going to revoke it. Again, this is just my opinion and my experience. I'm not a lawyer. I don't give legal advice. I was trained as an investigator. I had to go national training, and then I've been helping nurses and their legal team for about 8 years. So
Mhm.
in this is all in my experience. But if it rises to that level in most states, a felony, and even common sense, just think about a common sense level.
Right.
You're not going to practice.
Yeah.
So that's administrative, civil, and criminal. And the criminal, you do understand, will then, of course, end you in front of the board of nursing.
Right. Right. So obviously then you recommend that nurses should carry their own malpractice insurance, right?
Yes, another great question.
Mhm.
Because again, people are like, they're going to go after me. Who knows you have it besides you?
Mhm.
No one. Honestly, no one does. And then you're sitting at the table. You don't think the physician doesn't have their own? They do.
Of
And so
course they
now
do.
you're
Yeah.
sitting at the table. It's the physician, their legal counsel, you, the hospital, and their legal counsel. Who's cutting whose check here?
Mhm.
It's no mystery. And then look at this, you're fired. You're terminated from the hospital, and now you're standing in front of the board of nursing. You don't have a job, and so you don't have liability insurance, which would afford you that administrative lawyer. So
Right.
how much
Yeah.
money did you have in reserve for that?
Yeah, so you're really left hanging dry. Right, because to hire an attorney is tens of thousands of dollars. Yeah, yeah. I mean, just the retainer alone is several thousand. And then, each hour is, I've seen them as much as $300 an hour. And every phone
Oh,
call,
a
you
thousand.
make with them, the clock is ticking, right? Yeah, so it's tens of thousands of dollars usually to have an attorney throughout a process.
And let's just talk about medical malpractice or liability insurance. I mean, I have not seen, if you're a nurse practitioner or you're a licensed independent practitioner, you own your own business, you're in a high risk population,
Mhm.
your liability insurance might be a little bit more expensive. But
Right.
honestly, you're not looking at more than $200 to $300 a year. Mine is a little bit over 100 a year. And
Yeah,
I'm not a
that's what mine is.
prescriber, right?
Yeah, yeah, exactly. Yeah, RN working full time. Mine is, I think it's a little over 100 a year. what, $11 a month. I mean, it's so worth it when I think of it. But I'll be honest, I went for a while without it. I was under that old impression, if you don't carry insurance, they won't sue you because they assume you don't have money. But then I realized, and this was after I became a homeowner, and I thought, well, I might not have liquid assets, but I have a home, I have 401k, so truly, I have net worth that I'm sure they'll go over. So that's why I started picking it up again. And I had it as a student too. I think they recommend students get, I mean, that just, again, it's insurance. It's like any insurance, right? It's like home insurance. I have renter's insurance, a car insurance. It's just so worth it. It's scary to not have it, in my opinion.
Agree, 5,000%. Because it is, no one's going to be there for you. So
Right.
it is, again, it is just like you said, home life. Pray that you never need it, but it is there for sure. And it's just too reasonable. It is way too reasonable.
Right. Let's talk about the Nurse Practice Act. I'm always amazed when I read social media comments and someone will ask a question, for example, like, oh, what continuing education do I need, this year? My license is due next month. And I'm like, well, that's in your Nurse Practice Act. You better read that and figure it out. People will ask what their scope of practice is. They'll say, hey, I'm an LVN or an RN. Can I do this? Can I do that? And I'm like, well, that's in your scope. And then their answer to me is, where do I find that? And that just surprises me. And again, I think a lot of it might be education. I don't think it's talked about much in schools. At least it wasn't in the 90s when I graduated. I mean, they mentioned it. They mentioned Nurse Practice Act, but that's it. Talk about the importance of knowing your Nurse Practice Act.
Right. And actually, Texas does have a pretty good one because it even has like FNQs. For one of the things that I do, because like you, I do get comments. People ask me, like, I'm an LPN, can I triage? Or licensed vocational practical nurse. I not only taught them for a short period of time, I went right to, it doesn't say specifically in the Nurse Practice Act, an LPN cannot triage. It goes on to talk about initial assessment. LPN cannot do initial assessment. Then you need to be able to extrapolate from there what is triage, a complex initial assessment. But for some reason, sometimes, like you just stated, nurses have this problem with getting there.
Mm-hmm.
And so the Texas Board of Nursing doesn't have a put out where it doesn't even say. And I did a TikTok about this, and I even read what they even talk about because of the limited scope of practice of an LVN or LPN. Those are the same words. People use them interchangeably.
Mm-hmm.
They're not able to triage. And not only that, because of their limited education, the person on the phone is not educated speaking to you, right? So therefore, your limited scope of practice, the two of you together is basically what they said, just a disaster waiting to happen. It's just not appropriate. Mm-hmm. And so, yes, just like you said, there are other things like Cornell Law, where it will dumb down your Nurse Practice Act. And I get asked that all the time. Mm-hmm. Put in scope of practice, Nebraska, Iowa, California. I guarantee you're going to come up with something. Not every state has position statements. What is a position statement? A position statement, I'll quote one for Texas. 1514 is a position statement passed in 1983 that says that as a nurse in this state, I have a duty to a patient that supersedes a hospital policy or a physician order. There's also a position statement on conscious sedation. Now, this is a great one to even talk about. The position statement does have limitations. And the position statement for conscious sedation, and I know this because in my master's degree, I created a tool whether a nurse should sedate or an anesthesia provider sedate. So I went to my own state as well to get guidance. It says monitoring to be blood pressure, respiratory rates, everything but end-tidal CO2, because that's evidence-based science that's new. It has everything on there but end-tidal. But if you were under investigation by a board, I can guarantee you if you've reported, it's because your hospital policy said that you were supposed to be following that standard. The minimum is the position statement, which is different than the rules and regulations, which do not provide you the guidance for conscious sedation like that position statement does. So does that kind of explain it better?
Oh, absolutely. And especially that first position statement you mentioned about how our act, supersedes, again, like a physician's order or even hospital, recommendations or orders or stuff like that. Because again, like, so if the physician would write for, whatever, 5,000 milligrams of morphine, and even if we ask him, and well, I asked him twice and he said it was the right order. So that's why I gave it. That is not enough. That is not an excuse, right?
In Texas, that specific statement is specific to Texas because a patient came to the emergency room. Most nurses know this, in Texas, complaining of chest pain, 1983. So we're not talking about having chest pain services. The nurse went to the physician and was like, "Hey, so patient has chest pain." He was like, we don't have anything to offer them. Tell them to go down the street. Patient had a bad outcome. Obviously, litigation brings it back to full circle. Even back in 1983, litigation with a nurse happened, but it rose to the position where the board of nursing got involved and created a position statement that says, right, that a nurse has a duty to the patient that supersedes a physician order or a hospital policy. So that does mean that, yes, if you have to lay yourself over the patient's body, whatever it is, you are their advocate. And that ties back to staffing. Now, every state doesn't have that position statement, but I guarantee you, they have language in there that talks about your duty to the patient. And you know this from the ANA, the Code of Ethics, all the stuff that we get beat down in school. You know that there's language in every rule, regulation out there that they will pull to use against you. Absolutely.
Right. Because it's all about safe assignments and safety and all that. Yeah, exactly. Yeah, so it's not enough to just say, well, no, I was given too many patients. There was nothing I could do about it. You don't have to accept them. Right, exactly. Correct. Yes.
Well, and then even touching on that. So on the last meeting I went to at the Texas Nurses Association, they were having a changeover and the lawyer was there for the Texas Nurses Association. They have lawyers. These associations have lawyers. So it was at the end, it was question and answers. And so I was like, oh, hey, me. I knew the answer, but my people were talking about pay and staffing. So I asked the lawyer, sir, if a nurse knowingly and willingly takes on an unsafe assignment, is that the definition of medical malpractice? Yes. Gasps in the audience. I said, please repeat that. If a nurse knowingly and willingly takes on an unsafe assignment, that is the definition of medical malpractice, correct? So this is why we have to teach people our boundaries. We have to know the rules and regulations that govern our license, because do you think they're going to stand to defend us?
No way. No. So, and that's, I agree. I'm like you. We got to get the word out. We have to empower our nurses, because as a younger nurse, I wouldn't have been brave enough to not accept a dangerous, assignment. There's no way. I would have been, oh, okay. I don't know how I'll do it, but okay, I'll take it, so we can't do that nowadays. We can't get away with it anymore.
And then where was your charge nurse? You know what I mean? That's where we have to stand united. The bullying, the abuse against one another, like, I don't tolerate it. Stop. We are all in this together. We have to stand united so that, you know what? We set our boundaries. And then again, I would come and I would come to your aid or whatever that looked like, especially if I was in charge. Tell me about what's happening. Okay. And then that's when I help advocate for you, because the charge nurse making my $1 more an hour with my years of experience. Right. That's my duty to you as well. But that's why it can't be this nurses who have 5 seconds of experience as a charge nurse. That has to end. If you don't have more than 5 years experience, please remove yourself from charge. Don't do that.
I agree.
It is irresponsible. Don't do that to us. No.
Yeah, I agree. Absolutely.
I love my people, and we can do this in a respectful, professional manner. I promise you, we can. It can be done. We have to stand united, and we will reteach them how to not only teach us, but how to respect us and the rules and regulations.
Absolutely. See what else? Oh, another thing is employer, policies and procedures. That's another thing that, again, I see a lot of questions on different social media, and especially I'm a wound care nurse, so I see a lot of my wound care forums. What's the proper procedure for this? What's the proper way to do this? And having worked at several facilities, I can tell them it depends on your employer. Please refer to your employer's policy and procedure handbook. Again, a lot of things are the same, but a few things are, well, no, this employer likes it done this way, or they use this device or this procedure, whatever. So please refer to your employer's procedures instead of asking it on a group, because so then if they do it wrong, what are they going to say? Well, Wound Care Karen said to do it this way. It's like, no, please follow.
Well, and Wound Care Karen is not going to come and testify, because what they will have on the big screen is your employee file with the checkbox that you got the education and you read the policy, even if you didn't, they don't care.
Yeah.
And they'll have that policy on the big screen. And that's a very valid point. Like you, I've done local, I've done travel. I
Mhm.
mean, probably, 50 different facilities. And just like you said, when I've worked ICU or the emergency, especially ICU, we'll use that one.
Mhm.
I can draw an arterial blood gas. I've been trained to do that. I have had my boxes checked off to do that. Some facilities, you don't draw blood gases. Respiratory does. Again, is it
Right.
within my scope as a nurse to draw a gas? If I have the education, training, and knowledge, and let me say that word again, as long as you have the education, training, and knowledge, then I can perform that task. But like you said, if I'm at a facility that specifically says respiratory therapy does them, and I'm like, no, I can do it.
Right.
Look, you have no leg to stand on. No.
Yes.
And
Yes.
it's
And we talked
responsibility
about
to
this.
know those.
Yeah, and we talked about this before. I think it came up in one of your posts about a PICC line. The question was, who can pull a PICC line? And I had a perfect example because it happened to me. In our outpatient wound care clinic, a patient was coming every day for hyperbaric treatment, and he had a PICC line, and he was done with his IV antibiotics. So of course he asked. He's like, "Well, I'm coming here every day. Hey, you guys are nurses. Can you pull this PICC line?" And honestly, one of the nurses I worked with was like, "Oh yeah, I'll do it." And I'm like, "Hold on a sec." And I pulled him aside. I'm like, we're an outpatient wound clinic and that's not in our scope. And he's like, "Oh, but don't you know how to do it?" Oh, no, I know how to do it. I've pulled several PICC lines as an inpatient nurse, but in our wound care clinic, that's not in our scope. So if something had gone wrong while we pulled it in our outpatient wound care clinic, how could I have justified that to the hospital and the lawyers and whoever else we were in trouble with? How could I have justified that as the nurse manager? I couldn't. And I'm so glad I said no, because 2 weeks later, the patient missed a couple of days of daily hyperbarics. And then when he came back, I said, "Oh, Mr. So-and-so, gosh, where have you been?" He said, "Oh, well, the funniest thing happened to me, Karen." He said, I was at my infusion center for them to remove my PICC line, and something happened. A piece of it broke off. He said they
There
actually
it
had to
is.
take me to surgery
And
to
there it
have
is.
that little end piece removed. And I
And
mean,
there it
he was
is.
fine, thank heavens, and everything. But again, had that happened on my watch as nurse manager, even if I wasn't the nurse pulling it, but I would have been in trouble. The nurse pulling it would have been in trouble. My MD would have been in trouble. It's not what we do in our area. And so that's why I wouldn't allow it. And I'm so glad I stood my ground. Again, so that comes back to, just because you can do something doesn't mean you should. So
Right.
please
And again,
always check, right? Always check your employer's procedures and policies for sure.
and that right there just tells me that even that nurse, the lack of education, because as someone who's worked interventional radiology, who's
Mhm.
worked inpatient units as well, that PICC line was measured. And so
Mhm.
when you go to remove it, there's a whole protocol with removal. Do you have when it was placed? Do you have the measurements? You
Right.
don't.
How would we know the
Again,
measurements? No.
correct. Correct. So solid. That's the other thing. Yes. And as someone who's worked again IR, when we have to go trying to retrieve that, or now they
Mhm.
had an MI or PE or
Exactly.
stroke, now defend that because you didn't have a policy, anything. Again, just like you said, leave your ego at the door. Because
Mhm.
again, just because you can doesn't mean you can in that setting. Absolutely.
Right. Be proud of your skills and accomplishments, but it doesn't mean you can just use them willy-nilly. Follow your employer's procedures and policies for sure. So you are just a wealth of information, Maggie. Can you let everyone know where they can find your website, your handles on TikTok, etc.? And I'll also include this in my show notes, but where can folks find you?
Sure. I don't get crazy. Advocates for Nurses, number 4 or FOR.com, at Gmail, TikTok, Instagram, Facebook. There's, TikTok I hear is going away. I'm on Instagram. I'm on Facebook as well. So
Great.
absolutely, reach out to me.
Awesome. But before we leave, and I ask this of all my guests because I'm a big Hollywood fan and movies and TV entertainment. So if you were to have a movie made about you, who would you have starring as you?
I thought about this, and it would have to be someone because I'm a total activist. So it would have to
Hmm.
be like who you would totally think traditionally, like a Jane Fonda or like a
Yes.
Meryl Streep
Oh, I
or,
love it.
even Dolly. Dolly
Mhm.
isn't like overtly, people don't see her as overtly, but she is. If you look at some of her old music, she is like an old female activist. So it would
Yes.
have to be someone who is a female activist for sure. So I would be
That's
honored,
awesome.
any of those ladies for sure.
Oh, that's awesome. That's a perfect answer. I love it. I love it. Thank you so much for what you do. Thanks for being a nurse advocate. I've just learned so much for you, and I really do encourage everyone to follow Maggie. Thank you so much for joining me today. I can't thank you enough. I really appreciate your time.
No, absolutely. I love helping nurses, and I'd rather educate than defend, hope to defend. Again, I am not a lawyer. I don't give legal advice. I do nurse case management, and I help nurses and their legal team when they're under investigation. But I would rather educate and prevent nurses than them, come to me upset. Because I do a support group for nurses, because that is a big deal, right? Because our people, the incidence of suicide and mental health stuff, if they're
Mm.
investigated. So we have to support one another, honestly.
Oh, that's awesome. That's awesome. And you're doing it in a really big way. Really, really appreciate it. Thank you so much. I appreciate it. All right. Take care,
Absolutely.
Maggie. I'm sure
You
we'll talk
too.
later. Thanks.
Okay, folks, so here's a few takeaways or things I learned from Maggie, my nurse advocate. And these aren't in any particular order. Number one, know your Nurse Practice Act. It has your scope of practice in it. It's easy to find. Just enter into your search engine Nurse Practice Act and then the state you live in. Number two, know where to find your employer's policies and procedures and follow them. Number three, carry malpractice insurance. Number four, always advocate for patient safety. Do not accept an unsafe assignment. So if you do all of these things, then you will be protected from any civil, criminal, or administrative proceedings against your license. And by the way, the podcast that Maggie and I were referring to earlier, it's from a podcast called RNegade, and the title is Dude, It's Simple Math. And they interviewed Robert Wingo. He's an informatics nurse, and it's a really cool podcast. You should check it out. RNegade, called Dude, It's Simple Math. And you might even be able to earn a CE if you follow their directions. Folks, this podcast was recorded in my studio on the hill in San Antonio, Texas in March of 2023. It was produced and edited by Wound Care Karen, and I did it all with a little kitty on my lap. The views expressed here belong to me and my guest, and not our employer or affiliates. If you like what you heard, please subscribe and give me a 5-star review. If you have ideas for future podcast content, please drop me a line at contact@woundcarekaren.com or message me on Facebook, Instagram, or YouTube. And remember, folks, time does not heal all wounds, so if you find that to be the case, please seek help from a wound care professional.